Part of what makes the AMGA a leader among physicians is their incredible leadership, knowing how and why things must change in order to achieve the best in patient care. Andy Rosgen traveled to Washington to check in on the top priorities of the AMGA.
We are here at AMGA headquarters in Alexandria, Virginia, talking with the president and CEO of AMGA, Don Fisher. Thanks for joining us.
Oh, it's good to be with you.
What is the biggest challenge in healthcare today?
I think the biggest challenge in healthcare today is the movement from volume and intensity of services reimbursement to one that pays on value.
What do you think is the top priority for the AMGA right now?
The old ways of providing care simply don't serve anymore. And AMGA has the opportunity and, in my opinion, the imperative to take a leadership role nationally in driving value-based care, which truly provides greater service, quality, and affordability.
It's to advance integrated care and to advance cost-effective, high-quality, high-service care to all Americans.
How do you measure the performance of a healthcare system?
Well, the first thing you have to have is an electronic health record, and then you got to implement that health record in an efficient way. You then need to be able to identify and stratify all the physicians within your enterprise so that you can look at the patients attributed to those physicians. And now you begin in a transparent way to report that data back out to the providers so they can see how well they're doing on those patients in two measures, quality and costs. And if they're not doing as well as their peer group, somebody's going to either talk to them or they're going to find somebody to talk to in order to figure out how to improve.
The value-based payment model for patients and doctors is now a reality. How do you envision that in the future for AMGA's membership?
We really do believe value-based healthcare is the way to go. It does everything patients want and need, and it really will reduce the cost of healthcare and improve the quality. So we're very much behind that movement.
We're just barely beginning to understand how we provide care, where the opportunities are. With the mixing of our access to technology, with our better understanding of coordination of care, and our better understanding of what our patients truly want and expect of us, we can redesign care in ways we've never even thought about before.
How important is it to end duplication of record keeping and testing for the patients?
Medical record, historically for sure, has not been shared between providers. So there's not the continuity of care that you need to have that high quality and low cost. So when a primary care doctor and a specialist and the ER doctor in the hospital all aren't communicating or seeing that patient's record, you simply, if you could connect those dots, you simply can't have quality, and you certainly can't have low cost.
From a patient perspective, how does care coordination work and why does it benefit the patient?
If you're going to really deliver on what patients need and want, you've got to put everything under one roof. You've got to have one-stop shopping. You've got to fully integrate that care so that there's one medical record that gathers all of the information in one place, so any provider anywhere in the system can see what's been done and what your outcomes are related to those procedures. And they have people who are charged with the responsibility of coordinating that care across primary care, specialists, subspecialists, inpatient, outpatient, so that it's all packaged together. That is the future. That's what patients want and need, and that's where we're going.
I definitely see a future where patients experience healthcare as a seamless, easy to access, supportive experience where they felt heard, where they are guided in terms of living their lives with great richness going forward. I believe we'll get to that soon.
I believe, as does Dr. Reardon, that we are, in fact, going to hit these goals. We're going to transform American healthcare, and we'll be successful in taking care of every American in a high-quality, low-cost, high-service way.